I'm Joe Ballard, a physician in the Division of Hematology and Oncology and a member of the Department of Humanities, Penn State College of Medicine. More things in heaven and earth. I was not accustomed to my device being taken so lightly, especially in a matter of life or death. Occasionally, my elderly patients had wisely decided to forego intensive cancer treatment. But in this case, a 20-year-old mother was refusing her chance to live. I dug in my heels. No matter how hard I tried, Emma could not be convinced to agree to chemotherapy. But that day we parted as friends, and she agreed to call me with problems, to have periodic blood counts, even to return to hematology clinic in 2 weeks. As I reflect now on Emma's clinic visit that day 24 years ago, I had mistakenly assumed this young woman would be just another in a long succession of unfortunate patients who, when faced with a diagnosis of acute leukemia, would want the most up-to-date treatment available. She had first come to my clinic on a rainy Monday in the spring of 1985. The nurse's chart noted that her family physician was requesting consultation for low blood counts in the 3rd trimester of pregnancy. My first impression on entering the room was that Emma was very young and very pregnant. Her smiling face, framed by a starched white bonnet, blue cape dress with no buttons, and plain black shoes, identified her as a member of one of southeastern Pennsylvania's Mennonite communities. Her husband, Reuben, sat quietly in the corner of the cramped examination room. He smiled broadly as he crushed my hand with his firm grip. The fresh scent of the earth mixed with that of lavender filled the room. She and Reuben had been married the year before, and both were overjoyed about the birth of what they hoped would be the first of many children. Her midwife and the women of her family were providing advice on how to prepare for her delivery at home. To this point, the pregnancy had been easy, and she had really had no bothersome symptoms. Her family physician had discounted the first laboratory report showing decreased blood cells. Unfortunately, a second test confirmed these abnormalities, but he and they were not worried because Emma looked so healthy and her counts had not worsened over the last month. I was worried. Although blood cell counts can fall slightly in late pregnancy, Emma's values, though not severely decreased, were all clearly below the expected range. We discussed my concerns about the risks of infection and bleeding, and she and Reuben understood and stoically accepted my recommendation that we do a bone marrow to determine why the counts were low. The procedure went well, and they agreed to return when the results were available. That evening, I began the ritual of interpreting the bone marrow aspirates performed that day by our hematology service. The microscope revealed what I had most feared. Emma had acute leukemia. The appearance of the cells and the confirmatory report of her chromosomal tests left no doubt that she had a specific blood malignancy known as acute promyelocytic leukemia. It was strange that the disease had not progressed more rapidly. By this time, Emma was close to her delivery date, and neither she nor Reuben outwardly showed concern as I delivered the bad news and described the usual course and treatment for acute leukemia. We talked about response and survival statistics, which, even in the mid-1980s, were in her favor as long as bleeding complications could be controlled. A complete remission was possible, I reported, in at least 75% of patients with APL, treated with a combination of 2 drugs given intravenously. Furthermore, I counseled an average remission lasted about 2 years, but for a patient of her age with this form of leukemia, a cure was possible. in about a third of treated patients. I explained that since her blood parameters were so stable that her obstetrician and I agreed that she should deliver in the hospital before starting chemotherapy. We would support her with blood transfusions as needed. To our relief, her counts remained only moderately decreased, and precisely on schedule, she delivered a healthy 8-pound baby girl without complications. During her follow-up appointment 2 weeks after delivery, I expressed a sense of urgency in getting her into the hospital to begin treatment. As she rocked sleeping baby Rachel in her arms, she patiently listened as I repeated the mantra, explaining the anticipated course of treatment and possible complications. I assured her that these were problems we knew how to handle, and after this, she would most likely enter a remission and then get on with her life, especially caring for her new daughter. She and Reuben locked eyes and quietly announced that they had already discussed this matter. With a smile, she confidently said that they decided she would not take chemotherapy because this was not a natural form of treatment. After an uncomfortable silence, I glanced at the baby and warned that without chemotherapy and a complete remission, the disease would take Emma's life within 2 to 3 months. Although she was steadfast in her decision, she seemed to want me to continue to be involved in her care, and she and Reuben agreed to return to clinic in 2 weeks. But she did not return. It was not difficult to imagine that she might have died of uncontrolled bleeding or a bloodstream infection. I assumed the worst until I received a set of labs 8 weeks later drawn by her family physician, showing slight improvement in her blood counts. To my knowledge, she had not received blood transfusions or any therapy for leukemia. Along the margin of the lab slip, Emma had faintly penciled, "Praise the Lord." When she finally returned 3 months after Rachel's delivery, she was beaming and appeared healthy. She did have a yellowing of her skin. She reported traveling to another state to visit a naturopathic doctor who had prescribed a strict vegan diet that included generous servings of green grapes, liberal amounts of a tea prepared from the bark of a South American tree, and 4 large glasses of carrot juice daily. I now understood that her jaundice was merely the result of excess beta-carotene from the carrot juice. And to my astonishment, her peripheral blood cells were now normal. She appeared to have entered a spontaneous remission, a phenomenon many oncologists can't accept. Although I did not have a scientific explanation for her apparent remission, I told her I was very happy for her. Yet my hopes could not overcome my nagging concern that we had not seen the resolution of her problem. And I explained that we should require close monitoring in the clinic over the coming weeks. As expected, she would not consent to another bone marrow procedure because she and Reuben knew her diet and herbal treatments, combined with her faith in God, had cured her. She planned to continue the diet and the carrot juice, and although grateful for our concern, she and Reuben had decided that they would prefer not to come back to clinic. The nurses and I shook hands with them and watched in dismay as they walked down the clinic corridor. Over the following months, Emma came to my mind on several occasions. My colleagues were intrigued but dubious about her remission, and soon her story was lost among those of the steady stream of new patients. 10 months later, Emma was brought to the emergency room, complaining of fever, chills, and intense leg pain and swelling. Her blood pressure was low, and she had many bruises. Her blood cell counts were all low, and several leukemic cells were now seen on her blood smear. Her blood clotting tests were grossly abnormal. She was still conscious and agreed to an admission for treatment with pain medication, antibiotics, and blood transfusion. But even now, she continued to decline chemotherapy, as well as mechanical ventilation and medications to support her blood pressure. Over the next day, her blood pressure fell and she drifted into a coma. Reuben remained at her side and frequently asked hopeful questions. Family and friends from the area congregated at the hospital to pray together. And they took turns watching Rachel, who clutched her grandmother's dress and peeked shyly at me. When Emma stopped breathing, Reuben and I stood at her bedside for a long time without speaking, while family and friends quietly flooded the room. Our eyes were red as we shook hands. He thanked us for standing by them for the 14 months since she had first appeared in clinic, and for just being there and accepting them as they were. For this young family, that had been Emma's most important therapy.